When it comes to hand issues, we see a lot of issues when it comes to tendonitis, carpal tunnel syndrome, cubital tunnel syndrome, and arthritis. When it comes to trigger fingers, those are pretty common. I think with some of the electronics these days, we see a little increase in trigger fingers, and there's a lot of treatments we can do non-operatively. We usually start out with medications and steroid injections. If those don't work, we'll add in occupational therapy, and if we're not seeing a change from a conservative management, we'll wind up doing surgery. And surgery usually will get you fixed pretty much all the time. When it comes to carpal tunnel, we see carpal tunnel pretty common also. That's a compression along the transverse carpal ligament of the wrist, and we can treat that conservatively too with splints and bracing. And then if that doesn't improve, we have injections we can do. And if the injections don't work, there's a small surgery that will also help fix the carpal tunnel. Another common issue we see is cubital tunnel syndrome, and that's a compression where numbness will happen in the small finger and ring finger, and we usually see it worsening at night. And if that happens, we usually start with mild versions of it with splinting and using a heel blow pad, so we're not putting pressure on our elbows as you progress through the day. And if we're not seeing a change conservatively, then there is also a surgery where we can release the cubital tunnel with an endoscope, or if it's more severe, with a larger open procedure. When it comes to arthritis, we do see a significant amount of arthritis involving the upper extremities, and sometimes it's as easy as doing a steroid injection or conservative management with splinting and letting it settle down, followed by range of motion. If it's more severe, especially the thumb base, we see a significant amount of arthritis, which tends to be symptomatic. Those situations, there are surgeries that can help out if it's more severe. And once again, with basilar joint arthritis, we can also treat that conservatively with splinting, bracing, and injections, and along the lines therapy, depending on what kind of symptoms you have. Arthritis affects the other joints too. Sometimes the small joints by the fingers, where the nails are at, that type of arthritis can be fairly symptomatic, and early on we splint and see if we can get it better without the need for surgery. But if that doesn't improve, then there are surgeries where we can fuse the joint, and that does lead to increased stability and better use of the upper extremity. The second joint, the PIP joint, that also can become arthritic, and we do the same thing, conservative management initially. And if that doesn't work, then we'll proceed with joint replacements or sometimes fusions of that joint. And that type of treatment can also happen for the MP joint or the third joint back, where if those become arthritic, we definitely have options. So whether it's tendonitis or arthritis or carpal or cubital tunnel syndrome, there's always a wide range of either conservative versus surgical management that can keep you moving. And our job is to figure that out and deploy whatever type of treatment we can in order to best fix a patient and have it really tailored to being very specific to the patient.